Hi, my name is Aubrey Page. I'm the CEO of the Change Starts Here Collaborative. And this month we were talking about mental health awareness, foster care awareness month. There's a lot of things going on, and we support parents and professionals of kids with brain-based disabilities. And so this is our jam. What I want to address right now is recognizing the trauma that our kids may have incurred just by having a disability. So a lot of times I'll talk to parents and their kids will have some form of neurodiversity, and I'll say, blah, 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 trauma. And they'll be like, no, they didn't have trauma. Or I don't understand why this is happening if the child did not have trauma. That rarely the case, right? The majority of adults in America have experienced trauma. And when we're talking about populations that are oppressed, racial minorities, socioeconomic, lower socioeconomic classes, and then the disability community, this is where we're talking about trauma, okay? So why would someone who has a disability experience trauma? Because everywhere they go in their life, people have expectations on them that they cannot meet. Cannot, notice I say not will not. Often as parents, we say our kids won't comply with whatever, but it's that they cannot do it because of their disability. And we theoretically don't yell at blind people for not being able to see, but when it's a brain-based disability, it's a lot easier to do. So how can we recognize how we may play a role in that? And then also recognize how others in the child's life may play a role in that, and how we can help guide those others, how we can help them manage expectations, explain the dynamic nature of their disability. In other words, we have good days, we have bad days, we never know what it's gonna be, and we need to have grace for both of those things, right? So we as parents set the tone on how people treat our children, and we can go into spaces and be like, nope, this is not going well, okay? This happens a lot in school, so we can go in and say, listen, the way that schooling has happened for this child is not going well. This is how we can change things to not cause further trauma, right? Use the term disability, make sure that you make this a big thing so that they recognize it. And often when we use the term special needs, people feel like they're coddling to our children, like they have just a special request, like I don't like carrots. That's not what a disability is. So how can we inform other people and advocate on our kids' behalf for this? So disabilities can cause trauma, and we can help mitigate it.